Well, I see we still have people joining, but I am ready to jump into this conversation. So I would like to get us started and welcome everyone to this time together. My name is Sarah Verbeest, and I direct the Jordan Institute for Families at the School of Social Work here at University of North Carolina, Chapel Hill. And I'm also lucky to be part of the Maternal Health Learning and Innovation Center. The Maternal Health Learning and Innovation Center is a national resource center. It's founded in 2019, so we're new. Our mission is to foster collaboration and learning among diverse stakeholders to accelerate evidence-informed interventions and advancing equitable maternal health outcomes through engagement, innovation, and policy. So we're excited to welcome you to our first session in our September leadership series, and I am so excited to be joined today by Miriam, Perez. And before we get started, I'm just going to give you a little bit of background. So at MHLIC, we are so excited about the work being done across the US to improve maternal health. When it comes to leadership, we know leadership comes from many places, and it isn't about an official title, job, or degrees. And we also recognize the need to support leaders from groups most affected by maternal mortality. We're really excited to have this leadership series as a chance to hear from leaders in maternal health or public health talk about their views on leadership. We hope you'll walk away inspired and with some practical tips for moving the movement to advance maternal health forward. We know there are many leaders working to end maternal mortality and improve maternal outcomes, and we are only talking to 3 of them in this series. If you want to share ideas about the kinds of leadership that are needed to advance maternal health, you can visit our inspiration board at any time, and there's going to be a link in the chat for that. And you can also nominate a leader to speak during an upcoming leadership series, and there's a chat, also a link in the chat as well. And so just a few quick logistics for today. So this is a conversation, no PowerPoint, just a great conversation, and we're going to start with some of our questions for Miriam, and then we welcome you to join the conversation in chat. So please go ahead and offer us your questions and comments. You all are muted, so you can relax and you're not on camera. So you can just relax and enjoy and listen, but please do make use of the chat to join the conversation. And finally, we are recording today. So now I get to introduce Miriam Zoila Perez. So they are an award-winning queer Cuban-American writer and activist. Perez graduated from Swarthmore College with high honors in anthropology in 2006. Their work, which mostly looks at the intersections of race, health, and gender, is motivated by a desire to understand how the world shapes our bodies and to explore all the many solutions that already exist for some of our biggest problems, but simply don't get the attention they deserve. Perez is a freelance writer and is the founder of Radical Doula, a blog that covers the intersections of birth activism and social justice from a doula's perspective. Perez's writing has appeared in the New York Times, Color Lines, Splinter, The Nation, The American Prospect, More Magazine, Rewire.news, and Talking Points Memo. Their TED Talk, How Racism is Harming Pregnant Women and What Can Help, has been viewed close to 1 million times. That's really cool. Perez got their start in the reproductive justice movement, where they worked for a decade, both online and off, including more than 6 years working with the National Latina Institute for Reproductive Health. They've also worked for over a decade as a consultant for social justice nonprofits, focusing on digital communications. And there is more to say. I'm not going to say it. But I want to say, Miriam, own all of this wonderfulness and all that you bring to this world and our conversation. And I'm so excited to get this time with you. So let's jump in and just start with leadership. So do you think of yourself as a leader?
Yeah, I would say so. I think it can look a lot of different ways, and it can take a lot of different forms. But yeah, to me, leadership is, in some ways acknowledging what your role is and the work you're trying to do, and what your role isn't, and kind of stepping into your strengths and working to support people and in collaboration with people whose strengths are different than yours or who have a different voice to bring to the table.
So did you start off with aspirations to lead, or did that happen How did that happen?
No, definitely not. I mean, I wanted to be an OBGYN. Initially, I went to college pre-med, and I got kind of knocked off that path by organic chemistry, which I know is like a really relatable thing, and also like an unfortunate kind of systemic thing about, you know, pre-med and medical education, that it sets up this these courses that are meant to weed out people who would be great providers, you know. So yeah, I was just always really interested in health and like women's health in particular. And then I got sort of stepped away from pre-med, and then got introduced to sort of the world of birth activism through a course on the anthropology of reproduction, and that kind of really energized me around what was wrong with the way that maternal health is being handled in the U.S., particularly like over medicalization of birth and treatment in hospitals. And so then I went down a whole different path and just found that, like, I think my strength was in writing. And so I think it's an interesting role because in some ways, you know, I'm very visible in those platforms, but I'm not at the forefront of the work by any means, right? Like, so my work is trying to uplift the people who are actually at the forefront of the work. But because of the way journalism works and the way that social media and platforms work, like, I'm sort of visible in some ways, even though I'm actually like would consider myself behind the scenes at this point, because I'm not an active provider in any way. So I'm not actually working with people through pregnancy and childbirth anymore, but have gotten the opportunity to like be sort of at the to be very visible in my work as a writer and activist. And I never would have imagined any of that.
It's crazy how our paths go, right? I think it's interesting how you talk about leadership, because like you said, it's a way of also uplifting the work of others and bringing that forward. And I think that that's really important. I think we have this kind of idea that the leader has to go it alone and they have to have all the answers. And I think that really challenges it when we bring in and lift up the other work and voices that are going on with the platforms that we have. And I think that that's definitely is a form of leadership. So along those lines, what do you think are good characteristics of leaders?
I mean, I think emotional intelligence is really important, especially if you're actually like leading people in sort of like a leadership role in terms of a work environment or a collaboration or whatever, right? Like people collaborating together can be really challenging. And so I think to be in a position of leadership, requires a lot of emotional intelligence, a lot of self-reflection, so that you understand your strengths and your challenges. And then, I think humility. It might seem kind of counterintuitive, but I think that, good leadership is, knowing when to step back also, as well as when to step up, and knowing when other people's names and work and leadership to be at the forefront.
I definitely agree with that. And I also think it's, along with that humility for me, it's also, there's so much I don't know, and being curious. I'm wanting to continue to learn, and sort of, I think there's so much in at least white supremacist culture that's like, you have to know the answer. If you don't know the answer, something's wrong with you, or you shouldn't be, as opposed to being curious and recognizing you don't have to have all the answers. You need to know, how to be connecting with other people where the answers lie. So what challenges we're all working within these traditional power structures and institutions. What are some barriers that you have faced, or challenges that you've had to kind of knock out of your way in building your leadership voice?
I mean, I think one of the big challenges in my work, because I've been in this like birth activist world and wanting to talk about racism and pregnancy, is that you have to convince mostly white folks that racism matters. And so the TED Talk was sort of like my experience doing that. And it wasn't that like every platform I had to be speaking to white people, but a lot of them do. And, even radical doula in many ways, like I thought of my audience as like white doulas. And so that's kind of a challenge, because the conversation has to start in a very different place than it starts if you're talking to other people of color. because you have to. So, when I did that TED Talk, part of what I tried to start with, like, I knew that it was probably my opportunity to speak to more people than I'll ever get to speak to in my career, right? So I took it very seriously, and I was like, okay, what do I want to say to sort of this like audience I know nothing about, right? Like they're a very generic audience in many ways. So trying to figure out how to explain the impact of racism on people's lives, I had to start with the most basic sort of sense of like physiology and stress. And so, I started with my own experience in that moment of like, feeling the stress of giving this TED Talk, to try and connect with people who may not understand the experience, never experienced the stress of racism. And so, I think that's a challenge because, yeah, when you're talking to a white audience, like you have to start in a different place than when you're talking to communities of color. But that's also sort of the reality of the United States and sort of who dominates these different fields and what it means to move people to care or to understand an issue from a different perspective. And then also, focusing on the work of a Black provider, Jenny Joseph, and like what she's doing right. And it's very connected to who she is and her understanding of racism and her experience of racism. So I think that's definitely been a challenge of just trying to understand how to approach my work. And then the intricacies of like who I am, I'm Latinx, but also very like fair skinned and can, pass as white in different contexts. And so how do I like acknowledge that positionality and utilize it, but also not overstep when it comes to, because the people that we're talking about when we talk about racism and pregnancy is primarily African-American women, right, who are facing these disparities. And there's some groups of Latinas and some groups of Native Indigenous women, but so I, in some ways, am also like an ally to that work because I'm not Black, and it's not my experience. So yeah, also like having to understand the uniqueness of like, when do I step in and when do I step back, and who leads the conversation. And, my approach has been to try and bring attention to the people who are most impacted, and the work of the people who are leading, who are, not coincidentally, mostly Black providers, who are really leading when it comes to solutions to addressing these maternal health issues. So yeah, those are some of the dynamics that have come up. I mean, my leadership, like you could think about leadership as like being the CEO of a company or being the ED of a nonprofit. Like I haven't done any of that in my work. So I don't like lead a lot of people in my work. So that's a whole different type of leadership. I've had a couple of times where I've like had to manage staff, but it's not very common in my work because I have a sort of non-traditional path, and work very independently. But those are the things that, when I think about like being in the public eye or being visible or being someone that people are listening to, those are some of the challenges of that.
Mm-hmm. Yeah. Well, I definitely see you as a leader in this space. And I think there's lots of ways that people lead. And I think you're right. We tend to over-center also the people that are kind of in charge of other people or organizations. And if we do that, we miss the important voices and work that's out there. So I want to build on what you've said, because we are trying to think about, well, how are we supporting leadership to do the big lift of improving maternal health? And I would like to say also people's health, regardless of pregnancy, because I think we matter no matter whether we are pregnant or interested in becoming pregnant. So I need to name that right here. But it's big work. It's big work. And I think if we do the work, it could be transformational in healthcare in many other ways. So I think there's, but how do we identify and build the leadership, the bold leadership that's needed to really move this work forward? So I guess, what are some thoughts about what should we be looking, this is getting messy. So you can jump in wherever you want. It's either like, how do we support the current leaders doing it? And how do we move along other leaders to kind of be joining? How do you see us like constructing this movement?
Right. The movement, like sort of like maternal health movement, or the movement, birth access movement.
Yeah, birth access.
Yeah. I think, I think centering the leadership of the people who are most impacted, right, by these issues. So Black women, African-American women specifically. And I say African-Americans because Black folks who immigrate to the United States have better outcomes than African-American folks, right? So that's like the distinction there is not just political one, it's like the specificity of what I'm talking about. And that's true also for like Latinx folks. Like the longer you are in the US, the more your health declines. So that tells you something about, called the immigrant paradox, you know, and it tells you something about the conditions of the United States, and how they impact people of color. But so yeah, centering the leadership of those who are most impacted. So people who've experienced, you know, health disparities during pregnancy and birth, people of color, specifically Black folks, Native folks, you know, I think, and then that's not a new idea, right? And I think it's become more, you know, there's been a lot of attention on that idea in this kind of couple of years since the uprisings last summer, you know, that there's more increased attention toward diversity and inclusion. And you know, having been in this birth activist space since like, I don't know, 2005, we've come a long way. Like people weren't even talking about racism and pregnancy and birth 10 years ago in the way that they are now. So, you know, it used to be sort of felt like birth activism was about like wealthy, you know, middle-class white women having better experiences giving birth in birth centers and at home. You know, like that sort of felt like that was the audience, that was the community, that was the audience. And now, you know, it's like, no, actually some people are dying. Some people are, you know, having really, really negative health outcomes in this process. And we need to be focusing on those people's experiences, and that will improve the experiences of everybody. But that needs to be the focus. Like this is where the crisis is. It's not just about, you know, the satisfaction level of women with privilege or people with privilege giving birth. So I mean, I think that's a huge part. And I think I hope, you know, I'm not as involved in the institutions that you all are involved in, but I hope that there's a shift, that not just a shift in the conversation, at least, about whose needs should be centered. But that requires a lot of shifts because these institutions are white dominant, you know, dominant culture places. And so it's not easy to be a leader who's a person of color in those spaces. And there's a lot of those typical tropes that end up making it difficult for people to succeed. So it takes a lot on behalf of the people in power to create space for that leadership. But, you know, those things that we talked about before, like humility and knowing when to step back, and those things ideally would assist, right, in creating space for voices of those who are most impacted by the issues.
It kind of goes back to our earlier conversation about really investing in learning and seeing, and naming what is the culture we swim in and what does that look like, whether you're in medicine or the academy or philanthropy or any public health, any place. What is that so that we can start to see what's unseen, start to see where we have, because I think that's the first step, and then being able to be more in genuine and honest relationship with new and emerging leaders, and being able to step to the side, again, not admitting you don't know it all, and then creating that space. Because I think also we say, well, we want to listen to leaders, but it's really disrespectful to listen and not act or deploy resources in a way that's going to build on what those voices are putting out there, at least in my opinion.
Yeah.
And so we had a question in the chat, which I think you answered, about the changes in the trajectory of maternal health since you've been involved in birth work. And I think you did talk about the movement. Yeah, I feel like I was like that birth center that was like, which is a start, right? There's so much work to be done. There's so much work to be done in terms of birthing in this country. And then I think to your point, it's really, really shifted and grown.
Yeah. There are a couple other things I can say that have changed. Yeah, so that piece around like really thinking seriously about racism and you know, pregnancy and birth, and then, you know, the conversation about gender has drastically changed. I mean, I felt so alienated when I first came into the work and was a doula, and very few like openly queer doulas, almost nobody who was trans or gender nonconforming, you know, so and also like very few people of color. So that's changed a lot, which is great. And, you know, even the language on the Maternal Health Institute's website, right, says like women and birthing people, like there's this real attention toward trying to be inclusive of people of all different genders who experience pregnancy, which I think is really cool. And then there's a much, I think, stronger sense of integration between like abortion rights and access and maternal health. So that those things used to be really siloed to the point where like I was in some midwifery spaces in the early 2000s, and I thought naively that the silence around abortion was because everybody was like pro-choice, and then I was told very gently by a friend, I was like, no, that there's silence because there's a lot of anti-choice midwives, and I was like, what, so that is still the case, but there's a lot more, I think, conversation both in the reproductive justice arena about birth and in birth activist spaces about abortion, and even some providers that try to like bring the two together and provide like access to all sorts of pregnancy options. And calling yourself a full spectrum doula was real novel 10, 12 years ago, and now it's become really mainstream to be like a person who supports people across the spectrum of pregnancy, and not siloing those things apart from one another. So it's been incredible. I called myself a radical doula back in 2007 when I started that blog, because I felt like my set of identities and my set of politics were radical, and now I don't actually feel like they're very radical anymore, which is cool. That the needle has moved enough that it's actually pretty commonplace to find doulas who are like me in lots of different ways, and I think that's really beautiful.
I agree. That's a lot of hope, right? If we think about that, then just everybody out there, where could we be when we talk again in 5 years, right? Mm-hmm. Where could we be? We could be somewhere and see a lot more people thriving as we go. I had one other, just thinking about what other leaders in maternal or public health do you look up to? So you mentioned Jenny Joseph in the JJ way. She's definitely, I definitely fangirl about Jenny Joseph. Who are some other folks that, are just people that you watch and, or that you are really got your eye on?
Yeah. Oh, there's so many amazing people. Loretta Ross is like obviously kind of a sort of like a grandmother of the reproductive justice movement, and I've gotten to know her a little bit over the years, and have a lot of respect for her political ideology. And I think it's interesting she's like moved into sort of like talking about call out culture, call in culture, and that's really interesting to watch her thoughts about that as like an elder in the movement. There's other providers out there that are doing really incredible work. Of course, like I think I have a learning disability around names. I have trouble bringing names up, but I'll put them in the chat because I've written about some other great Black providers in the maternal health, pregnancy and birth space who are doing really incredible things. And even like seeing the similarities between like Jenny's model and like the model in DC, that's the provider's name I'm forgetting, but I'll look it up. Seeing what they do in common and what they do differently, and like what are those threads, because the main thing they have in common is that their outcomes are really good. So like even though they work with low income Black and Latino populations, they have really good outcomes. So I think providers like I think they get, especially providers who aren't MDs, can get really overlooked, right, as leaders, but they really are, because they're the ones who are providing the care that like we actually know how to give good care. We know how to provide care that prevents maternal mortality, that prevents infant mortality, that to have healthy chunky babies that Jenny talks about. So we don't actually have to find new solutions. What we have to figure out is how to make those models, what makes those models work, and how to put them in other environments, particularly environments that aren't led by Black midwives, because that's a really small population. We need more Black midwives. That's amazing, but we also need other providers to figure out how to give better care. Jenny Joseph, Allison, and we can put some links in the chat. I've written about her work, and she has some websites and stuff about her model. But I mean, to put it briefly, she's actually a British trained midwife. She's from the UK, and she's of African descent, and she works in Florida. And she has a prenatal care model, essentially, that she calls the JJ way, that almost eliminates maternal health disparities among the Black and Latina clients that she works with. And one of the things that's coolest about her work is that she doesn't catch those babies. Most of those clients want to give birth in the hospital, and they give birth, and not in her birth center, and they give birth at one of the highest volume maternity wards in the country in Orlando. And they still have incredibly good outcomes, and that's because of her prenatal care model. And I wrote about her work for the New York Times, and that's like she's the center of my TED Talk. But yeah, just think, people who figured it out by being on the ground and wanting to care for women and babies and folks giving birth and figuring out how to do it well. So thank you for putting those links in there.
Yeah, thank you, team. Yeah, it's exciting to have a chance to learn about so many amazing people out there that are doing really creative and smart work, and there's just a lot to learn from their perspectives and their stories. And I appreciate the work that you do, like lifting those folks up, because people need to know who they are. So I have a couple of other questions in the chat. I feel like our chat is wanting us to just take another minute on what we were just talking about with RJ, in terms of the acknowledging that we brought up this topic in this space. I'd also feel like it's important to talk about miscarriage, infertility, and stillbirth. There's just a lot of silent suffering and feelings around that as well that we also don't often talk about. And so the question that we have from Alyssa, who is working on her MPH thesis on abortion doula care in Georgia, a big fan. Awesome. Alyssa's curious about how your perspective on how doula care and abortion doula care specifically can change in the face of restrictive abortion legislation in the states and in the South. That's an easy one for you.
Yeah. I think one of the things that's so cool about the doula model of care is that it like brings lay people back into sort of care providing, right? So people who aren't, although the doula model in some ways is becoming kind of like professionalized and medicalized and like more trainings and more certifications. But I think at the core, it's this idea that like we all can benefit from a compassionate kind of witness to our experiences, and that has a positive impact. And so I think what's inspiring about that is that bringing like health and wellness sort of outside of institutions and back into our own communities and our own power. And so I think what we're going to see, right, the only way that you can prevent the state from criminalizing abortion is by bringing the ability to care for people's pregnancies and to end pregnancies back to into people's like hands, right? And it's already been done, and it's been happening, right? There's been people who have been finding ways to control their pregnancies and terminate pregnancies outside of healthcare systems forever. And it's just going to become more urgent in places where the state is trying really hard to prevent providers from offering it. So it's scary because, like there's a lot more criminalization now than there was in, the 70s before Roe. The rate of incarceration, the sort of use of the criminal justice system, the prosecutors, like all of that stuff has gotten more intense. So there's a lot of safety concerns for people who are trying to figure out how to support each other and how to get access to, safe methods to terminate pregnancies at home through herbs or medicines that are pretty readily available, medication abortion and stuff like that. So, I think that's the answer, unfortunately, for better or for worse, is that it's going to have to be kind of reclaiming that knowledge and that process for people themselves, because the institutions are clearly pretty invested in preventing it from happening in certain places. So not to say that we shouldn't fight like legal battles, like those need to be fought, because some pregnancies can't be dealt with at home and they need advanced medical care. But I think a lot of it is going to have to be taken back into sort of community knowledge. And the doula model offers like a pretty great vehicle for that.
Yeah, I definitely see the doulas, community health workers, and just as a way of democratizing information and medical information, right? And just like bringing that in a way that's understood and that we can share and support each other. So thank you for that answer. So I'm gonna, we've been talking about leadership, it feels like a bit in the clinical space. But we also have a lot of public health organizations out there that are really ready to do this work, engaged in doing this work. So how do you see the public health community being able to be agents of change in this space?
Yeah, I gave a talk at a public health conference at UNC a number of years ago, and it was all about the idea of like public health folks as disruptors. I'm not in public health, so I'm an outsider to your field, but I think of doulas as disruptors in many ways, right? Disruptors of power exchanges, disruptors of norms around, what people deserve, disruptors in terms of providing this like very basic but kind of radical, compassionate, non-judgmental support. So that's what I would wonder for you all. It's like, what does it look like to use public health to try and disrupt some of these norms that exist inside of these healthcare systems? And then the other thing that's interesting is like with providers, when you talk about things like social determinants of health, they're like, oh, that's public health work. Like that's not our work. But like, how can you be a provider and not think about social determinants of health? And I think that's really changed, right? Like the work around ACEs and just like, of course, I'm also going to forget her name, but I'll look it up. She's now the Surgeon General in California, the state of California, another Black provider who's an MD who's done a lot of really foundational work around ACEs and trauma. So I think you know, some of the success of public health work is making providers understand that that the social determinants are not a separate thing from health, that they are health. They're like one and the same. And so what does it look like to continue to like bring that lens and make people see that it's actually part of their, it's a core to their work as well. It's not just the work of public health folks or social workers or something like that. So yeah, I think that's the question I would ask for you all. Like, what does disruption look like? What does it look like to really try to change the balance of power in the institutions that you're a part of? Thank you, Nadine Burke-Harris. Exactly, yes. I really need to work on my name recall. I'm terrible about Jeopardy.
I'm with you. That's one good thing about Zoom is people's names are right by their faces. I found that to be really personally very helpful for accounting for that as well. You know, I'm also thinking when we think about public health leaders, I think also about like how the data that we share and how we talk about the problems, there's a lot of power there in shaping the narrative and the conversation. I think data can be powerful to push change, and it can also be constantly reinforcing implicit bias and stereotypes. So I think if we have to model the change that we want to see and be, I think, in a lot of ways.
Yeah. Yeah, I mean, that was, I think, a part of the problem of the conversation around maternal health and race for a long time, was this idea that these disparities were either place the blame on the individual communities, right, for behaviors or whatever it was, like a really like kind of capitalist and racist idea, or even worse, like made it seem like these things were tied. Like if you were of a certain race, then you were definitely going to have these problems. And so the conversation then became finally like, no, racism is the problem, not racism. And so that's one of the things that these providers like Emily and Jenny, like they don't assume that their clients, because they are Black, are going to have these outcomes, right? They know that they have a higher risk for it, but they're not. Whereas, if you take that data out of context, or you don't bring a social change lens to it, you can become sort of, it becomes a self-fulfilling prophecy. You're like, oh, you're going to assume that certain problems are going to happen. So no, they know that those problems are more likely, but they also believe that it's possible to get to healthy pregnancy. And then to start to blame racism rather than race. And so when you blame racism, then you know that it's not intractable. It's not a biological problem. It's, you know, race is not a biological reality in that way. But the social context of race, which is racism, creates these issues. And so, yeah, the data alone can tell all sorts of stories. You know, people think, oh, when you talk about these disparities, it must be poverty. Well, no, like actually look at the data based on income. It doesn't get any better when people's income gets better. The disparity actually gets worse. So you know, if you've listened to my TED Talk, I'm repeating some of those things, but yeah, data without context and without some sort of like activist ideology can be misused and really can be very damaging, actually.
So lots of work can be done. Everybody has plenty of work to do in this space and can, I think, lead in this space for sure. So I think to answer this question, you've been in a lot of different spaces and different groups. I know we were talking before, boards and just all different things. And I want to talk a minute about decision making and how you've seen decision making, right? And so tell me, like, can you share a time when you saw a group that you thought was super functional and inclusive in their approach to how they made decisions? Whether it's how money is spent or how something, or if you've not witnessed that, what do you think are elements that make that positive? Because it's a really important conversation about decision making.
Yeah, I mean, I feel like the groups I've been a part of have been like small number groups. Like I have partnerships and things that have been really productive. So it's different when there's two people versus a group. I mean, the things that come to mind are kind of like the basic things of like making sure everybody's opinion gets heard, making sure that, but it's really difficult because there's power dynamics in those spaces usually, So I don't know. I don't think I have like the answer to that question. I think it's really difficult because capitalism is a hierarchy. Capitalism is a power structure, and so even in collective spaces, there's often power dynamics that are at play in terms of who has seniority or whose voice is heard better, or other types of marginalization that impacts people's dynamics. So I think it's really difficult to do effectively, and it goes back to that question of like the emotional intelligence of the people who are holding the space, and how do you create a space where people feel like they get to weigh in on decisions.
Mm-hmm. Yeah, I think starting by, I think you can think of almost any organization in terms of really, where is the power? How are decisions made? Who is at that table? I mean, I think those are starter ways to start to unpack and at least be transparent about it. And then I think from there interrogate, how do we shake that up, and what would that look like in terms of strategies?
Yeah.
So in your bio, you say that you're motivated to explore all the many solutions that already exist for some of our biggest problems, but simply don't get the attention they deserve. I love this. I love this. I love this. So can you share about how leaders can help do this? Like, can you unpack that a little bit for us?
Well, I mean, I think we can get really focused on problems, right? There's a lot to say about problems. So that can kind of like suck all the air out of the room. And this is very true about journalism. So part of why like I focus on that in that part of my bio, because I as a journalist, it's like 90% of news is the problem, and how much of it is about the solution. But I think that's also can be true outside of journalism and in like activist spaces as well. That you focus too much on what the problem is, and so much less time on what we can do about it. And ever since Trump was elected, I've like tried to cultivate optimism as like a practice. It's not in my I don't feel like it's in my DNA, being the child of immigrants. And like there's just like a lot of, I think, worst case scenario thinking that's just like ingrained in me. So I have to practice optimism. And I think part of practicing optimism is understanding that like many of the problems that we face, the solutions already exist. We just don't get them. We don't pay enough attention to them. So that's just been my own, like I was writing for Color Lines, Trump gets elected. What do I do to keep myself feeling sane in this moment? And part of that is looking to the solutions. Like, people say, look for the helpers, right? That kind of thing. Like, knowing that we have to talk about the problem, right? Like I could have just done that TED talk about like how racism harms pregnant women, like that would have been a TED talk, but that would have been so much less, I think, impactful than, and also you learn a lot about the problem by understanding what the solution is, right? It's like understanding that people's nervous systems can be buffered and soothed in the context of prenatal care such that they have better outcomes, like tells you a lot about the way bodies are responding to the threats and to racism. So what can leaders do? I don't know. I mean, this is just my kind of like path has been to really try to focus on what we know works, what we want. I think sometimes on the left, we can be a little focused on like tearing down, but not building. And I think we have to build. We have to have a sense of what we're trying to build. Otherwise, what's left, So another person I look up to a lot is Adrienne Marie Brown. I'll put her name in the chat. She's a writer, and she's also a doula, which is cool. I don't know how much she does doula work these days, but she's an optimist for sure. I mean, I haven't asked her this question, but I would say she's an optimist. And like, all organizing is science fiction. She just wrote a science fiction novel that just came out, but But I like her voice a lot because she's super real about the problems, but also very real about like, there's a future. I mean, if we don't believe there's a future, like what are we working towards? So I don't know if that answers that question in as much directed toward leadership, but I mean, I think one of the problems, right, is that because of all the power hierarchies of whose ideas get seen, who's seen as a leader, who's seen as like valid, like there's probably a lot of answers in the room that you don't even know about because the people who are, one of the things I think is really cool about both Jenny and Ebony's models is like they really care about the people who work at the front desk also being part of their success, right? So there's a real clear hierarchy. Like, of course, the provider's at the top and the administrative, the receptionist like is going to be, but that's not how they see it because they understand that the way that the person who greets you, treats you when you walk in the door immediately has an impact on how you feel. So that person has some answers to the problems they're trying to fix. So in your institutions, like, where are the answers? And maybe they lie in places that you don't expect and not the person who has all the letters after their name, necessarily, not to diminish anybody with letters after their name, but that's not where expertise only lies. And that oftentimes there's like the people with more experiences, the people who are more impacted are less likely to have those, letters after their name because of racism and institutional barriers.
Yeah. Oh gosh, there's so much in there. I want to talk about, first of all, Emergent Strategies is an awesome book. We read part of it for my policy class. Like how awesome. The book also has drawings on a playlist. Like what books come with playlists to listen to while you're reading the book. And what I love about it is there's just different ways of approaching our work. And I think this is where creativity and fun comes in and joy, as you're saying. And that's something that is in a lot in that writing is like, where's the pleasure from the activism that we have and where when we can connect with these amazing thought leaders and these great solutions. And as we see that there's hope out there, like how that can be transformative. And I think how that I feel like, to your point, everyone in this kind of healthcare ecosystem, it's just not working great for anybody in some cases. And so I think where's that listening and liberation. So yeah, I definitely would recommend folks to check out that great work. And so question, what are you willing to share that you're feeling optimistic about these days?
Yeah, that's a great question. I actually actively seek out good news, and there's like a few. I was trying to look quickly to see if I could find the name. There's a few like outlets that offer good news that are actually like legitimate. It's not just like puppies and kittens, but they do a lot of, and I'll see if I can find it before we're done. I can share, but they do a lot of reporting on. It's like solutions journalism, but really focused on positive stories. And there's been a lot of like, despite all of the doomsday stuff about climate, right? Like this, there's a lot of really alarming stuff about climate change. There's also positive stories or things that people are trying, right? Like, I don't know if folks follow climate stuff, but the first, carbon capture factory, essentially facility came online like last week in Norway or somewhere like that, right? So actually trying to take carbon out of the atmosphere and then they're going to turn it into stone underground. It's really fascinating. I don't know a lot about climate science, so so it's not that I'm optimistic about climate change, but I'm optimistic that, it's like the solutions are here. We just have to, it's about will, it's about will. So, it's been an incredible couple of years to watch the Black Lives Matter movement really, become so central in so many ways. And obviously like the murders of Black folks and other people of color at the hands of police continues to be a huge problem. And we had a polarized initial election where we talked about things like defund the police. The fact that was even like a word that anyone had to articulate, even if they were articulating a position against defunding the police, but the fact that was the talking point, like that's incredible. That's incredible. I don't think that we would have thought that 10 years ago that mainstream politicians would be talking about the idea of defunding the police. So, and I personally think that's a good thing, like that I have sort of more abolitionist stance against things like police and prisons. So, there's a lot to be really upset about, and there's a lot of suffering, but I do think that there are ways in which we can see how things have changed that yeah, where we're going to be in 10 years from now, and hopefully in a totally different place in many ways.
Yes, I think also I feel really lucky to work where I do, and I know I see some of my students on too. But I just think it's our up and coming group of folks that are already leaders in many ways. I think are the voices that can also keep pushing along. And I think there's a lot of kind of shared work we can do together. Which is really, that's something that makes me feel really optimistic about as well. Awesome. So, okay, I need to ask you just one question about your TED Talk, just because, you know, it was famous.
Sure.
So it's, like you said, it's an incredible platform. So how did you get to the TED stage? And like, how can we get more people there to like, how do we get more leaders like you with that kind of a platform? So how did that happen?
Yeah. I wish I had a better answer than like nepotism, but unfortunately the answer I have nepotism. So a friend of mine, Courtney Martin, who is a feminist author, actually just wrote a really interesting book about race and education as like a white parent of white children in Oakland. I'll put her name in the chat. She was part of TED Women, and she was part of a team that got to decide who was on the TED Women stage, and that's the TED Talk that I got to do. And she just kept, and I've known her for years since we were part of Feministing together, the feminist blog from a long time ago. And she's just been a big champion of my work, and she just kept pitching me. I think she said it took like 3 or 4 years before they were like, yeah, this person seems interesting. So we need more people like Courtney. You know, she's one of those people who's, you know, a beautiful leader, and that she's got a lot of humility, and she opens a lot of doors for other people with her privilege and her access. Unfortunately, she's not working with TED Women anymore, so she's not the gatekeeper anymore. But yeah, so I wish I had a better, like, this is how everyone can do it kind of thing. But it's a great platform, and it's not the only one, and it's not necessarily the most influential of all the platforms. It just happens to be the one that I have access to. So I wouldn't want anyone to be discouraged by the answer, but also it sort of shows you that this is how the world works, right? It's about who you know, fortunately or unfortunately. And so that's how those kinds of opportunities come about. So no one should feel bad about not having that opportunity. It's not about merit at all. It's really about who you know. And I have to give a shout out because my mother is here. She's actually a professor at UNC Chapel Hill. I grew up in Chapel Hill. She's a professor in Spanish literature in the Romance languages department, which I think has a different name now. So anyway, shout out to my mother for being here. I only told her about this like half an hour ago because I'm not a very good child.
So, you know, so to your point about other platforms out there, a lot of them I think I read in your intro bio. And I'm wondering for the folks out there, there's some other platforms that people have something that they want to say, or some space that they want to be showing leadership or to be bringing things forward, any place that you could offer or suggest. And then likewise for people that are in leadership positions, where should we be watching and paying attention to see the folks that we should be reaching over to and listening to as well? Any suggestions?
So the first question was like, what platforms do people have things they want to say?
Yeah.
And then tell me again the second question.
So then also, you know, where should leaders be listening, right? Besides to this great.
Yeah. I think the challenging with platforms is the gatekeepers, right? So it's not easy necessarily to get like the places I've been able to, the things I've been able to do and the platforms I've access have been through my relationships. But I think the exciting thing is that every time there's a new platform, it presents an opportunity where there's like fewer gatekeepers to allow people to get an audience. So, you know, I joined blogging when it was kind of new, and that helped me to gain an audience, particularly because I had like a niche that I was trying to reach with Radical Doula. And then like podcasting is another example where like the moment is a little bit past at this point, but like a couple of years ago, there was an opportunity for new voices to reach that platform because all the like institutional gatekeepers weren't there yet. And so I did actually start a podcast about Latinx music that I'll link in here in case there's any music people in the room that I'm going to record an episode of when we get off of this call. But so, and then TikTok is another great example, right? Like brand new platform, lots of opportunity for all these new young creators who are not already have big names on other platforms. So I'm not saying you should all go, you could start a public health TikTok. I feel like TikTok is there's still a lot of room for new creators there, but and I'm on there just as a participant, not as I don't create any content there. So I think that would be my tip for people who don't already have an audience, is that like pay attention to new platforms and see where you can potentially create an audience and a voice for your work there. And TikTok is incredible because there are a lot of people doing health things and doing, like it's a real variety. Yeah, TikTok is amazing. I know I feel like an old head on there because I don't, really understand the technology, but I'm like an elder millennial. But it's amazing. And there's a whole like world of like people trying to talk back to anti-vaxxers, and like it's incredible. So yeah, I think that's my tip, would be like new platforms are really the way to make an audience for yourself. And then I think the people that I've been shouting out in the comments would be the people that I would direct y'all to. If you're really interested in other like, birth activist folks, Ancient Song Doula Services and Chanel Portia is amazing. She's she founded that group, and they, I think it's Portia Albert, serve predominantly Black and Latino women in Brooklyn and New York, and have an incredible model, just like looking to those providers who are working with people on the ground and have a reproductive justice analysis, have a full spectrum approach, some of those folks as well.
Yeah, I feel kind of like it's like kind of challenging this construct of white supremacy and like the written word and what that means. And it tends to mean a certain type of written word in a certain place that you have to somehow be able to have money to access. And I think this really, there's a place for that. And that can't be it. And so I think valuing the knowledge and wisdom in these other spaces is really important. If we're really going to shake it up and really see the solutions that are out there and identify the folks that we may want to respectfully see if they want to build a relationship with us to be in a leading space together. So I love all of these suggestions, and I think that that's just part of the revolution, is who we're listening to and how we're listening. And I think that's exciting. We did have one question for you. Do you give talks in Spanish?
I have, but not very often, but I would love to do more, have more opportunities to do that, because I love speaking Spanish and connect with kind of a different part of myself. I'm definitely more comfortable in English and like consider myself English dominant, but yeah, I would love more opportunities, and have done, organizing work bilingually and in Spanish, and yeah, and it's incredible the sort of growing, there's been like a growing attention to language justice as an approach. So not just like, we have interpreters in the corner, but like, what does it actually mean to decenter English and center other languages and make space for people who speak lots of different languages? So like the organization I work for now, we do everything bilingually, and it's incredibly time consuming. And also it's a politically grounded thing to say, no, actually, this is really important to center, to not just create an environment where English is dominant. So yeah, I would love to do more of that.
Absolutely. I have a feeling you're going to get some calls.
Oh, El Pueblo. Lovely.
Thanks so much. That's awesome.
Great. Yeah.
So I would just like to kind of step back and give you the stage. So if people were only going to remember a couple of key messages from listening to you, what do you really want them to be?
I think that the thing that's optimistic about the research I did about racism and health is that there are interventions that work. Obviously, the bigger intervention is like, we need to end racism, but that's like, a lifelong project. And so while that's happening, what do we do to improve the experiences of people of color right now? And the reality is that there's a lot that can be done, and it's very much about the nervous system. And I think that's also, there's more attention now to like nervous system regulation and what does it mean to regulate the nervous system, and what are tools for regulating the nervous system. There's a lot of that on TikTok actually, which is really cool. So I think that's the beauty of it. And so I think if you're a white person listening to this, part of your work in in ameliorating the impacts of racism on health is working on your own implicit bias and microaggressions. So the way in which you interact with people of color, that can have a negative impact on their health. We call them microaggressions, but they can actually, over time, have a negative impact on people's health because they create a state of constant activation, even like the threat of discrimination. So even if it seems like a benign interaction, if it's a negative one, it contributes to people's state of arousal. And then for people of color, what does it look like to resource yourself and to create buffers that ameliorate the impact of racism? Because it's gonna, people are gonna experience racism. It's just the culture that we live in. So what are those social supports, community supports? And on my website, I can put a link in the chat, but I wrote a series of articles about the impact of racism on health more broadly, like not just maternal health, and specifically looking at this question of what can help. And there was one piece that particularly had a lot of information about self-regulation as a tool for combating the impact of racism. And what was so positive to me about that is that it wasn't like, if you don't have these skills as a 2-year-old, you're screwed. Like, these skills can be built over time. Even they looked as old as like young adults, like in college age students can be given improved self-regulation skills that can then improve their health outcomes in the face of discrimination. So I think that's some like optimistic news. And I think I want people to understand that, like, racism impacts health, and there are things that everybody can do about it. It's not just like, throw up your hands, right? But like, actually, if you're a provider, how do you create a healthcare environment that is relaxing, that is soothing, that is de-stressing, that is lower stress, and that starts with the person at the door. And if you're an everyday person, what does it look like to be in community with people in a way that reduces the amount of triggers they experience? And if you're somebody who experiences these triggers, what do you do to take care of yourself? So I think that's the thing that I'll leave y'all with.
I definitely have taken a lot from our conversation. And I think one of it is also that leadership is inside work. You can't not do your inside work, and regulating your own emotions and learning and growing and knowing it's okay not to have all the answers. And that there's such a wealth of opportunities out there to grow. And that I think the other thing I'm taking away is I've just been smiling is the sense of joy in the change, and the ability to see a new vision so we can get there is really exciting.
Thank you so much, Sarah.
So, and to everyone that's been out there and chatting, to your mom, we really appreciated you joining us tonight. And to all the folks that are listening afterwards, we'll make sure that all of the resources are available, and our inspiration Jamboard is available. We also have a quick survey if people want to suggest speakers or just say hello. So we have 2 more conversations left in this first part of our series. So one is tomorrow, which is Wednesday at 5:30 p.m. Eastern time, and we'll be joined by Regina Benjamin. And then Thursday at 1, we're going to be talking to Abigail Echo Hawk, and links are in the chat. So find out more at maternalhealthlearning.org. I'm going to go and sign up for TikTok. No, if I'm missing out in a terrible way, clearly. And it's just been such a great evening with you and with everyone, and just many blessings, and thanks for your work that you're doing on behalf of so many.
Thanks so much for having me. I really appreciate it.
Thanks, everybody.